If you're struggling with severe eczema and losing hope, then this video is for you. Hi, I'm Dr. Soong, and I'm a board-certified dermatologist. Welcome to my channel where I talk about all things related to the skin, hair, and nails. If you're new here, I'd love if you subscribe to my channel and hit that notification bell so you don't miss any of my future videos. Atopic dermatitis or eczema is a multifactorial disease related to your genetics, the immune system, and the environment you're in. It can start at any age, and it's common to begin as a baby or in childhood. Shows up as itchy, scaly rashes in the arm creases, behind the knees, the neck, face, and hands, or pretty much anywhere on the body, especially if you have a more severe case. Severe itch, skin pain, sleep loss, missing school or work, secondary infections can all happen. And if you have severe eczema, you know how awful it can be to live with. Now, up until about 8 years ago, we had a very short list of treatment options. Those were moisturizers or ointments, gentle skincare, avoiding fragrance or irritants, dietary changes, which often are underwhelming in terms of response, topical steroid creams, topical calcineurin inhibitors, light therapy, and then immunosuppressive drugs, which can be heavy hitters like methotrexate. But there's been a significant improvement in treatment options in the last 5 years, and it's given new life to so many of my patients that struggle with bad eczema. We now have at least 5 different medications specifically approved for moderate to severe cases of atopic dermatitis. This video, I'm going to focus on biologics as a group of drugs that we now use. And in a later video, I'll talk about another group of medications called JAK inhibitors. Biologics are a type of medication that are made up of proteins. This is a type of biologic material. In eczema, studies have shown that there's an increase in type 2 inflammation. When we look even deeper, there are 2 main chemicals called cytokines that are driving this type 2 inflammation called interleukin-4 and interleukin-13. These are being made in excess in people with eczema. Now, these biologic proteins that we're now using are designed to target the very specific cytokines that are being made in excess or block the receptors that they bind to so that we can slow down this inflammatory process. There are 3 biologics now available for eczema: Dupilumab, which goes by Dupixent, tralokinumab or Edtralza, and lebrikizumab, also known as Ebglyss. Say those names 10 times fast, it's quite a mouth twister. Now I'm going to focus on Dupilumab because this was the first kit on the block for eczema, and it also is being used in asthma and other allergic conditions now. It's designed to block that type 2 inflammation, which is what drives eczema. It specifically reduces the effects of interleukin-4 and interleukin-13 by blocking the receptor that they bind to. Now, it's approved for 6 months of age and older. Did you hear that? 6-month-old babies can take this medication. It's an injection treatment like an insulin pen that you inject into the abdomen or thigh. It has to be injected not because it's a more aggressive treatment, but because it's a protein, and if you take it by mouth, your stomach would just digest it. It's once every 2 to 4 weeks depending on your age and weight. The great thing is that overall, it has minimal side effects. The most common is what we call an injection site reaction at the site that you do the injection. So people might experience a red bump or hive or swelling at that area, but usually it's self-limiting and goes away within a day or 2. If you're prone to cold sores, some people experience more frequent flare-ups, and it can cause eye symptoms. So itching, dryness, tearing, redness, rarely more severe problems like light sensitivity or blurred vision. Rarely, other side effects would be joint pains or allergic reactions to the drug or component of the injection, which can happen with any medication. Now, this medication does take time to work. Usually we check the response after 4 months of treatment. For over half of patients, they have at least a 75% improvement in their eczema, which for eczema sufferers is a pretty big deal. It also substantially reduces the sensations of itch, which helps you live your life more joyfully and you get better sleeps. Some people experience clearing up of the body eczema, but there have been some cases where people develop this persistent eczema on the face while taking this medication that can be a little bit harder to treat. We're still learning about why this happens and what to do about it. It is a medication that people can safely continue more long-term to keep their eczema under better control. Overall, as a dermatologist, this medication has changed the lives of so many of my patients in such a positive way, and it's nice to see them all happier and less itchy. Well, that's it for this video. Thanks for watching. If you have severe eczema, just know that there's more options available to you now. If you are an eczema sufferer and you've been on one of these medications, let us know in the comment section down below how it's worked for you.